I'm Dr. Gurpreet Padda, Regenerative and Interventional Pain Physician at Regen.md. I'll own a flaw that's also my engine, a curiosity so relentless it's sometimes impractical. When patients kept asking me, can I fix this without surgery? I couldn't give the reflex answer. I had to dig into every trial myself. What I found is more hopeful than what most arthritis patients are told, and more honest. For 30 years, I've seen the assembly line medical model fail those in pain. Today, we look at the data that the industrial machine ignores. Let me show you the truth about your joints. You were probably handed a grim binary. Manage it with pills until it's bad enough for surgery, as if your only roles are to endure and to wait. In the corporate insurance model, you are a passive passenger on a conveyor belt leading to an operating table. That framing steals your agency and your hope at the same time. But arthritis is not a simple countdown to the OR. It's an active biological process, an active signal, not just a wear and tear diagnosis. And because it's a process, it can be influenced. You have far more leverage than that binary admitted. You have the right to metabolic sovereignty. The promise today is simple. I'll show you the evidence that the standard surgical fixes for arthritis often don't deliver, the non-surgical levers that genuinely move the disease, and how to combine them into a real plan. We aren't here for false hope or magic pixie dust. We're here for the honest, evidence-based middle path you were never offered because it doesn't fit a procedural billing code. We're going to analyze the biological soil of your joints, the cytokines, the inflammation, and the metabolic signals that determine your trajectory. It's time to fix the terrain. First, let's perform a forensic audit of the surgical reality. In rigorous trials like Mosley et al. In the New England Journal of Medicine, arthroscopic surgery for knee arthritis performed no better than a sham operation. Imagine that cutting into a joint and doing nothing had the same outcome as the fix. Yet, the industrial model keeps cranking out these procedures. Why? Because the normal MRI trap ignores the functional pathology. We see patients who are normal on paper but in agony because their biological terrain is toxic. Surgery on a toxic terrain is like repainting a car with a blown engine. Arthritis is driven by inflammation, specifically pro-inflammatory cytokines like TNF-alpha and IL-1 beta that actively degrade cartilage and sensitize your nerves. Think of these as a biological fire. Standard medicine tries to smother the fire with steroid shots, but steroids are just a sticker over the check engine light. They might hide the signal, but they can actually weaken your tissues and cartilage over time. True regeneration requires neutralizing this dysbiosis. We need to transition the joint from a toxic inflammatory environment into a stable anabolic state where healing can actually occur. Now look at the leverage you control. In a controlled trial by Strath et al., changing diet composition reduced osteoarthritis pain significantly, even when weight loss was identical. It's not just about the weight, it's about the signals you're sending. Acellular carbohydrates and industrial seed oils are jet fuel for joint inflammation. They trigger the NLRP3 inflammasome and fuel mitochondrial retrograde signaling that tells your joint to fail. When you cut those inputs, you're not just dieting, you're performing a targeted metabolic intervention to quiet the cytokine storm. Here's the non-obvious economic truth. The non-surgical levers that work best, diet, metabolic correction, targeted regeneration, are the least profitable for a procedure-based system. There is no billing code as lucrative as an operation, and nobody markets the anti-inflammatory plate because nobody owns it. Meanwhile, the food industry profits by selling you the subsidized carbohydrates that inflame you in the first place. You are being inflamed for profit, then offered surgery for profit. The cheapest fix, changing the biological inputs, has no sales force because there's no patent on metabolic sovereignty. When we layer in regenerative medicine, we move from masking to modulation. Platelet-rich plasma, or PRP, isn't magic. It's a professional repair crew of growth factors sent exactly to the spot that needs fixing. For serious injuries, we use BMAC, bone marrow, aspirate concentrate, harvesting your own biological repair kit. But we don't just aim and shoot. We use sub-millimeter precision under ultrasound guidance to target the subchondral bone, the foundation of the joint. We pair this with focused ESWT and class 4 lasers to trigger mechanotransduction, forcing the tissue to wake up and rebuild. So, here is your non-surgical plan. 1. Attack the inflammation at its source. Cut the industrial seed oils and acellular carbs and track your metabolic score for visceral fat. 2. Get a full metabolic workup. LDL-P, TNF-alpha, the biological soil. 3. Add evidence-supported regenerative options like high-dose PRP or BMAC to support the tissue, paired with smart loading. Muscle is the organ of longevity. We must protect it. And 4. Measure and adapt. You may not erase every bit of damage, but you can change the trajectory dramatically without a high-risk surgery that might not have worked anyway. Can you fix your arthritis without surgery? For many, the answer is a resounding yes, if you're willing to take command of your biology. Taking command of the inputs driving your disease is metabolic sovereignty. You stop waiting passively for the operating room and start actively bending the curve of your own health. At Regen.md, this restorative path isn't a side hustle. It's the whole point. If you've been told to just wait for surgery, book a consultation and let's build your alternative. Stop managing. Start regenerating. I'm Dr. Gurpreet Padda. Let's fix the terrain.